Hello, Stephen.
Hello.
How are you?
Very good,
Fine.
thank you.
I have a question about similarity between Pakistan and Australia is that both face the colonial time. And I think so, at the start of last century, 1901, we got the freedom.
Yeah.
And about Pakistan, it was 1947.
Yeah.
And we got the freedom. And after that, after effects of colonial time we are facing. There are 78 years of freedom, but we face a lot of after effects of colonial period.
Yeah.
I have a question for you. The question is, what sort of after effects of colonial period in Australia, and how the government state manage it?
Well, we've had colonial times since 1778, and we still have issues in regard to colonial times with our Indigenous forebearers and our Indigenous people. So there's still some issues, and we just passed legislation recently here in Victoria for the first time where we've passed legislation on a treaty for our Indigenous people. We have 6 states and 2 territories, and we have a federal government, right, that oversees that, and then each state has their own laws also. All right, so that's how we deal with that sort of thing. Sometimes there's a bit of conflict over it, and the federal government, if there's similar rules in the state as there is in the federal government laws are over and above the state laws. So we're still working through those issues, but we're very lucky because we're quite a united country, so we're very, very lucky with colonialisation, and although we still have issues with our Indigenous people. Well, our civil services are our public service, and they're run by either state or federal government. Right? And it's not really colonial, even though our laws are under the Westminster system. It's run by Australian governments, state Australian governments, right? While it's related back and it probably mirrors some of the colonial times, it's not strictly colonial.
Okay. Is there any training academy for politicians here?
No, there's no training academy for politicians, and you don't even have to be qualified at anything. You can come from your background and experiences could be quite different. We have school teachers, we have lawyers, we have doctors. I was a paramedic, and then I was working in a trade union. I ran the ambulance trade union for 23 years, so my experience was in a trade union. So you don't need to have specific qualifications. There's a lot of people that have been involved in politics.
But what is the process of capacity building program for politicians? They must have the relevant knowledge, and they can command, they can deliver the results, and for the legislations. What is the capacity building program?
Well, primarily it's just that you've got an interest in politics. And in this country, generally speaking, we have 2 sides of politics, Labor or Liberal, right, generally speaking. And if you're a member of those parties, you will be involved in local branch meetings. So you have an involvement in politics, you take an interest in politics, you follow it. You might even get a job within an office of a politician just to get some experience, some political experience. And even from there, you might then show an interest to try and be pre-selected and elected as a politician.
There is a big issue and crisis in the world about the politicians, about problem of character and integrity. How the state manage and rectify the process of character and morality in the politicians?
Yeah, sure. Well, one good thing in this country, in our politics, if there's any potential of any lack of credibility of someone coming into politics, that would be well known. And our media are quite ruthless. They would pull that apart and highlight that someone lacks credibility or that they're being corrupt or something like that. We also have agencies that investigate that. So if there's a level of corruption alleged against me, I would be investigated. And the state has agencies for dealing with that, and so does the federal government have agencies for dealing with that. So we have all these levels of integrity commissions, an ombudsman and, integrity and oversight commissions and things like that. So that's how it's dealt with. I'm not saying there's no corruption. Of course there can be levels of corruption, but that normally is investigated and found out and ceased.
I have a question. There is a big issue, mental health. According to WHO, 3 out of 1 person is disturbed in worldwide. And depression is the top disease, according to WHO. Even in my country, it's a big issue. And there is a big suicidal ratio, even in the civil services. A few days back, a civil servant, police officer, SP, commit suicide. And it's a big challenge for the whole society. What are the precautions and proactively actions by the Australian government in this regards?
we had a Royal Commission here in this state into mental health, and there were a whole range of recommendations that were made. We had to improve our services, our mental health support services, and we've done that. We still got a long way to go. There's still a long way to go where people get access to proper medical support, mental health support. We have, through Parliament, if people are feeling stressed or depressed or anything like that, we have what's called an employee assistance program that you can ring up a confidential number, you can speak to them directly, they're either psychologists or counsellors on the phone, or you can have a meeting with them face to face. So we have those processes. If they feel through that process that you need to go off and see a medical professional or a psychiatrist, then that can be organised. So we have those and we have those services out in the community. We also have services where you might go into one of our public hospitals, be treated by a medical GP, and then be referred off to a psychologist or psychiatrist. So we have that. And then we have mental institutions or mental hospitals that can treat people if they're severely depressed, that they need hospitalisation.
Okay. Is there any mental health campaigns in students and publics just for awareness?
Oh, absolutely. There's big information campaigns, awareness campaigns run by many, many different agencies. We have a number of charitable agencies that support the community and make people aware. We have different days during the course of the year, like Are You OK Day, just to check on your friends to make sure that they're okay. So we have a lot of those things. There's also where individuals, where someone has suicided, sometimes family members have raised money and become a charity to try and make people aware of things because of the tragedy in their family. So we have a lot of that throughout this country.
What are the main causes of mental health issues in Australia?
Yeah, that's a big question. There's many, many different causes. A lot of it can be due to fatigue. Lack of sleep and things like that, pressure at work, pressure at home. Sometimes it's drug and alcohol induced, so we have those complications. Sometimes people are bullied and harassed, whether that be at work or in different, and we have a lot of family violence in this country. So there's a lot of issues around that. Some people have underlying I suppose, medical conditions that can lead to mental health issues. So there's a whole range of different reasons. Sometimes it can be combined issues, it can be someone has an underlying mental health issue, but then they have drug and alcohol issues with that, So yeah, it's very complex. It's complex. Yeah.
So do you think that the family circle and family connection and the social fabric is very important for the good mental health?
Oh, absolutely. Absolutely it is. I think it's fundamental to supporting people and hopefully preventing mental health issues even becoming bigger issues, or even early detection, prevention, early detection. I think family and community support is so important. Just having that people around you supportive, knowing what you're like, supporting you, helping you at any particular time, recognising that something's happening, or you've changed in your personality, or something's happened in your life, some traumatic event or something like that. So there's no question family support is ultimate.
Is there any campaign related to lifestyle? Because in the world, metabolic syndrome is increasing day by day. Even in my country, there are more than 20% population affected by metabolic syndrome. So is there any campaign related to lifestyle which is related to 2-time meal is enough, and fasting is very good, and to save ourselves just through changing the lifestyle without any medicine?
There's campaigns around lifestyle, not so much fasting in this country. There may be within the different cultural groups, but not in the Western culture. It's not a thing that's really done in Western culture, the fasting. It's quite the opposite actually here. We tend to eat more when you've got mental health issues. But there are campaigns around physical exercise, eat good dietary habits, those sorts of things, watch what you take as in medication and things like that. And then of course alcohol intake. So there's many campaigns around that to prevent some of those mental health issues, then you need to make sure that you try to be physically fit to make sure you're mentally fit. So, yeah.
As a worldwide, there is a concept which is prevailing with the book 5 a.m. Club. promoting and encourage that, we have to awake early from the bed for a good health. Is there a trend to awake early, go to work, go to schools, go to factories, go to workplace?
Yeah, it's interesting. Look, our culture here is that we tend to, this is my view of it, that we have a very busy lifestyle and we tend to pack more in, have less sleep, get more tired, create mental health issues.
Okay.
You know, so we've not one that sort of take a step back and rest properly. You know, as soon as you get up, you're off to work, you're off to school, you're off to education. You put as much into the day as possible, and then you come home and deal with family or other things that you deal with, your personal things. That tends to be what happens in our culture here. Yeah.
Thank you. Thank you, Sifat. Thank you.